Thank you, Rosalie. Good morning, and thank you for attending. So I'm just here to give just a very brief introduction of framing this issue of muscle quality. The terminology in muscle quality is as nebulous as it is in sarcopenia. So you hear the terminology as muscle quality, specific force, physiological cross-sectional area, intrinsic force, functional muscle tissue, muscle quality index. And if I went around the room, I could probably identify about 10 more of them. So, the way I think about it is it's basically a measure that is a property of muscle strength that is divided by the muscle mass or muscle size. This is a nice study by David Rush showing that this is in older and younger rodents, that upon higher stimulation frequencies, there is a big difference, age-related difference in the specific force that really represents other things that are going on at the muscle level and at the nervous system level. So if we just look at the very simple correlation between leg lean mass and muscle strength, you show actually a pretty darn good correlation of explaining about 50% of the variability in leg strength. But in reality, we know muscle strength is the result of many factors, very multifactorial. And on this side we have the nervous system, on this side we have the muscular system, all relating back to the loss of muscle strength, as we term dynapenia. And today, really what we're focused on is really talking about this idea, this loss in contractile quality that may contribute to this. And even beyond that, we're really focused on measurements of architectural changes, ectopic adipose tissue infiltration, and how that relates back to contractile quality and the measurements that we can use to assess it. So what's the clinical relevance of this? Well, there was actually a nice study done only about a month or two ago that was published in Journals of Gerontology, Medical Sciences. And this is hand grip strength predicting mobility limitation, mobility impairment among older adults. And the predictive or the odds ratio is about, I think that's about a 2 to 3-fold higher odds of mobility limitation with lower grip strength. Now, when you add in a measure of muscle quality, such as taking grip strength and dividing it by fat-free mass, body mass, fat mass, and what they did was basically a large survey of all the different ways to divide strength. And you could see in general from just hand grip strength, you can see a general improvement in the prediction capability of these other muscle quality or specific tension measures. And the two here seem to be a little bit different between men and women. So the objectives here are to provide a venue to discuss muscle quality in the context of skeletal muscle function deficit, and also to evaluate and expand standardized assessment of muscle quality. And a big part of this is really borrowing from some of the other literature, and this is an MRI image of a muscular dystrophic patient on the left here compared to a normal child on the right. And what you could see is here is a large difference in the chemical shift artifact here in the fat of the soleus compared to a normal child without dystrophy. So borrowing these ideas from other literature could really help us out.